Hello, my name is Charles Williams. I am one of the respiratory therapists here at St. Joe Regional Medical Center. I've been a respiratory therapist for about 28 years, 20 of which have been here at St. Joe Med Center. A respiratory therapist is a healthcare professional that sees a wide range of patients with lots of different lung problems. We may see and treat adults that have chronic lung disease such as chronic bronchitis or emphysema, as well as kids that have asthma, RSV, bronchiolitis, all the way down to little babies who are born premature and have underdeveloped lungs. I would say the main thing that differentiates a respiratory therapist from, say, a nurse or a physician is our specialized focus on the lungs. Typically, it's a 2-year program that we go through. Currently, most programs are switching to a 4-year program. So, one of the more interesting and challenging things that we do is something involving a ventilator. So this is an example of a ventilator that we might use on a patient admitted with coronavirus or COVID-19. So these patients, their lungs become really stiff and non-compliant, which will make it harder for them to breathe. They basically tire out. We can use the machine to take over that work of breathing for them so that they can rest and heal. So with the ventilator, the particular modes that are available can allow us to help patients breathe, whether they're breathing completely on their own, or we can support patients that are spontaneously breathing but may need a little bit of support versus full ventilatory support. It allows me to control the number of breaths per minute that the patient requires, how much total volume they need, as well as the amount of oxygen that they may require. One of the nice things about this particular ventilator is the display kind of shows me different changes with airway resistance and lung compliance, so I can make changes and adjustments as necessary for that particular patient.